Okay, Mr. Watson here, and in this video we're going to talk about venous return. So venous return. So just like in the last video when I was discussing the pulmonary and systemic circuit system, and then I went on to talk about the blood vessels, I focus on the systemic system, and that's because this fits right nicely in with venous return. Because as we know, venous return is the blood returning to the heart through the venules, into the vena cava, and back to the right atrium. And this is largely against gravity. Of course, some has the support of gravity, the blood returning from above the heart, but the majority is returning against gravity. Okay, so just going to go through these mechanisms which assist this slow-moving blood against gravity, because we do need to maximize venous return for exercise, because as we know, we have a far greater demand of oxygen, so it's really important. Okay, so venous return, returning of blood back to the heart through the venules and veins to the right atrium. Okay, so exercise requires a far greater venous return to increase stroke volume and therefore cardiac output. So this is Starling's law, and there's a little reminder on the right there. An increase of venous return gives us a larger end diastolic volume, which increases the elasticity, that greater stretch on the ventricle wall, which causes a greater, more forceful contraction, which increases stroke volume and therefore cardiac output. But we have additional mechanisms to assist maximize venous return. So we need to maximize this. So let's take a look at these mechanisms. Well, the first mechanism we should be very familiar with, because we've talked about valves in the heart, and I also mentioned them in the structure of veins. And these are the one-way valves that prevent the backflow of blood. And there's your valves when they're open, so the blood is passing through, and then they close on the right side of the diagram to prevent the backflow. And it's as simple as that, really. We can move on. One-way pocket valves to prevent the backflow of blood. We then have smooth muscle, which I've just covered in the structure of the veins, so should be familiar. And it's that layer of smooth muscle. It's thinner than the arteries, but it allows us to venoconstrict specifically, because we're looking to create venomotor tone. Now, what venomotor tone is basically the amount of tension that already exists, okay, or the muscle constriction of the blood vessel. Okay, so we already have some tone there, and what happens is we just create more venomotor tone. So they venoconstrict, okay, and it aids the movement of blood. Okay, so this smooth muscle venoconstricts, it creates more venomotor tone, and that aids the movement of blood. Okay. The third mechanism is gravity. And this specifically is talking about the blood that returns from the upper body, so the blood above the heart. It's assisted by gravity. So while we have the main proportion of blood, okay, returning against gravity, we do have some from the upper body that's assisted by gravity. Okay, so it's helped to return by gravity. That's mechanism 3. We then have the muscle pump. Okay, so during exercise, skeletal muscle contracts. So if you look at the diagram there, and let's just say this is the gastrocnemius. The gastrocnemius is contracting, and that contraction compresses the veins located between them. Okay, so when the gastrocnemius, for example, contracts, it compresses the veins located between them. And what happens is it squeezes the blood back to the heart. So this muscle contraction essentially compresses the vein and squeezes the blood back to the heart. Okay, and you can also see in that diagram the pocket valve, the one-way pocket valve, which is closed because we're looking to squeeze it up against gravity from the gastrocnemius back to the heart, and the muscle is contracted. So that is the fourth mechanism, the muscle pump. The fifth mechanism is the respiratory pump. Now, we'll talk about the respiratory system more when we move on to that part of the syllabus, but it is also a function of the vein and a mechanism that helps venous return. So when we inhale, so like during inspiration, when we draw air into the lungs, okay, we create a difference in pressure of the thoracic cavity and the abdominal cavity, okay? We also create a pressure difference in between the air outside, but we'll talk about that in the respiratory video. But what happens is, okay, in the thoracic cavity, which you can see on the diagram there, that the lungs, we have that minus sign. So we've decreased the pressure there, and we've increased the pressure in the abdominal cavity. And what that increase in pressure does is it squeezes the blood back to the heart. So we create this pressure difference, okay, and that helps squeeze the blood back to the heart, okay. So as exercise increases, okay, respiratory rate increases, so the respiratory pump is maximized, okay. So basically it helps, this pressure difference helps squeeze the blood back to the heart, okay. So we lower the pressure in the chest, specifically in the thoracic cavity, and this increases the pressure in the abdominal cavity, and the blood in the rest of the body is pushed back towards the heart. So they are our 5 venous return mechanisms that assist getting as much blood as we can back to the heart, helping push this slow moving blood back to the heart. Okay, thank you.